Hello guys, I am Dr. Jayavrat and welcome back to my YouTube channel. Today we are going to discuss what a root canal treatment is. So just imagine you're sitting down peacefully and you have a sharp shooting pain on one teeth. Whenever you bite, it pains and it's like unbearable. So you go down to a dentist, they take an X-ray and they tell you that you might need a root canal treatment. So what is a root canal treatment and why do you actually need it? So we're gonna discuss that today. So imagine there are multiple teeth in your mouth, but just for an understanding purpose, I will tell you that a teeth has different layers to it. Okay, so the innermost layer is the pulp, which has blood vessels, and this one, it has blood vessels and nerves, which actually make the tooth alive. The middle layer is dentine, and the outermost layer is enamel. So what happens is, when you have a cavity, maybe you developed a cavity on this part of the tooth, and this tooth has been broken and you have cavity inside the tooth and there are germs over here. Now what happens is that these germs infect this part of the tooth, which is the pulp, and the infection travels down to the bone. Imagine this being the bone, the outer part is the bone, and this, the junction where the pulp actually meets the bone, this area gets inflamed. Inflamed meaning there is infection over there and it starts to swell up. There is infection or bacteria which get accumulated over there and they start to cause a swelling over there. Now because of the swelling, this tooth pops up by at least 0.5 to 1 millimeter, which is not noticeable clinically. Like when you see it by yourself, it is not noticeable, but whenever you touch or you bite your teeth, that tooth is the first one to get or come in contact. That is the reason why you will have sudden pain. So what happens is, what we've understood till now is ki you have a cavity which is big enough, which is involving the pulp of the tooth, and that infection has traveled down to the junction of the bone and the tooth, and it has caused an infection, because of which the tooth has popped up a little bit, and because of that you're having pain. Fine. So now coming back to what is root canal treatment, how do we treat this? So what happens is, first we clean this area with the help of our dental motors or machines, and then before this actually we give you an anesthesia which will anesthetize that area or which will make it numb. So in that area of the mouth we will be giving you a small injection in which that area will be anesthetized. After that, this whatever we do in this procedure or whenever we clean the tooth, it won't pain because that area has become numb. Fine. So what we do is that we just don't clean this part, we actually clean the entire tooth from here to here. Fine. And these two openings become clear to us. Okay, so where the blood comes out from and where the circulation and nerve endings, everything is there. So this part is then cleaned with the help of different files. Different you might have seen or you will see small needles which they will be putting it down in the teeth, and they'll be cleaning and removing whatever infected pulp tissue is there. So that cleaning will be done. That cleaning is supposed to be done in 2 sittings, or maybe the first sitting is usually just the anesthesia, and in the second sitting you would not be given an anesthesia, and the cleaning would be done just to see that if there is any remaining infection left. So usually it takes 2, maximum 3 sittings. In some cases, if the infection has increased or is very infected, they might also have to put a medication and leave it for 10 to 15 days. That is a different situation, but majority of the times 2 to 3 sittings is good enough in a gap of 3 to 4 days. And you also will have to take antibiotics during the procedure. After that, once this cleaning is done, we cannot just leave it empty, because any hollow cavity inside the body could cause an infection, or there could be again bacteria which could develop over there. So what we have to do is we have to fix it, and we have to fill it with an artificial biocompatible material. Fine. So then this filling, this entire thing is cleaned, and this part of the tooth is then filled with biocompatible tooth material. And now, once the tooth has been root canal treated, now this marks the end of the root canal treatment. But we cannot just leave the tooth like that, because now since we have cut the blood supply and there is no nerve endings, the tooth is virtually dead from inside. So if we just leave it like that, the chances of the tooth breaking increases, because when the tooth becomes non-vital or becomes dead, the physical properties of the tooth change and it becomes more brittle. Brittle meaning it is easy to break. So it won't happen the same day, it won't happen in a year, it won't happen in 2 to 3 years. But suddenly after 2 years, when you're biting or having something hard, one tooth could, one part of the tooth, maybe this side of the tooth, could just chip off. So then the life of the root canal treatment completely comes down. Then maybe you will have to go for another root canal treatment before undergoing the bridge or the cap. So it is always advised that immediately after you do the root canal treatment, you should also get a capping. Once the tooth has been done, so imagine that the filling was done. Now this was the actual shape of the tooth, and this was an empty cavity over here. So what the dentist would do is, we will do a little more filling over here, and we will make the tooth a little small. This tooth size will be reduced, after which a tooth cap or a crown will be fitted onto the tooth, so that the strength increases and the life of the root canal increases. So some people ask that what is the life of a root canal treatment? So it also depends on the person who is getting it done, and it also depends on how well you maintain it. If you maintain a root canal treatment well, and you don't let any food deposit over there, and everything's good, it can even last for a lifelong. But in case if food keeps getting lodged over there, and if you keep having problems, and if you keep neglecting your dental appointments, you might start to have problems in 5 to 6 years again. So it is obviously advised that you should get your dental health checkup done at least 1 to 1.5 years, once in 1.5 years, so that every procedure or all teeth have a check. And some people also ask that what would be the cost of the treatment. So the price actually varies, but not that much. It depends mainly on the cities. So maybe in a metropolitan city, this would cost around 7 to 8,000 rupees. And if you check it in a second tier city, the cost would be around 4 to 5,000 rupees. And if you go further down to a third tier city, or maybe a small village, someone might be doing it for maybe 2,500 or 3,000 as well. But the point being, that's not just the end, you also have to get a cap. So that is also another, depending on different varieties of caps, it can range from 5,000 to 15,000. So again, there's a range in that. Keeping the cost aside, this is what a root canal treatment is. It would take around 3 to 4 appointments for a dentist to completely finish this up, and you would be given an anesthesia on the first appointment, and then your pain will completely subside. Okay, so I think that's good enough, and I've explained root canal treatment pretty decently. So in case you have any other doubts, just put it on the comments below. And thank you for watching my channel, and I'm Dr. Jayavrat, and I'll see you in the next video. Bye bye.